We're going to talk about Invisalign attachments. On the commercials you see for Invisalign, a lot of times they have already perfectly straight, perfectly white teeth, and they have in their aligners and it looks like nothing is on their teeth. Of course, this is not real life. In real life, to get the teeth to move, we need to have what are called attachments that glue onto the teeth. So what this is it's a tooth-colored filling material. We prepare the teeth and then we use a little template that comes with your Invisalign. We put it up on there and we light those attachments into place. The attachments will be a different size and a different shape for each tooth depending on the movement that needs to happen. Some of them will be in the back is more for an anchor. Like I'm a tooth that's holding everything steady while these other teeth move. Some of them will be for rotations, for up and down movements. There's a whole lot of different options that we can use. That's why it's nice to use an orthodontist because we know exactly what attachment would be best for each tooth to get you a predictable result. That's what we're going for with these attachments is predictability. So you may have seen some do-it-yourself at home aligners on TV. Those are harder because there are no attachments on there. So the tooth movement, the way it presses against the teeth is a little bit different than using the Invisalign system, which has the attachments that you get put on in our office. The attachments will go on multiple teeth, and it depends on your orthodontist or your case specifically how many attachments you will have. In our office, I am an attachment heavy orthodontist because again, predictability. I believe that the attachments get you the result that we're looking for. We need something for the plastic to be able to push against for that tooth movement to occur. So the attachments will glue on during your treatment. They also help your aligner to stay on a little bit more tightly. So that's another reason we use them and to engage with the teeth and to help with movement. If you have an attachment come off, not a big deal. You come see us, and if we need to, we will get your tooth ready and put it back on for you. When we finish, the attachments are very gently taken off the teeth and the enamel is polished. It does not cause any damage to the teeth to take them off. That is just part of the Invisalign treatment that will help us to get the results that you're looking for. This is an example of what the attachments look like on the teeth. So as you can see, not every single tooth has an attachment, but many of them do. The attachments glue on there. They are tooth colored, so you can't really see them, but when you put your Invisalign in, there will be a space in the Invisalign where the attachments will pop into place. If you are a coffee drinker or drink lots of tea or eat foods like curry, sometimes the attachments can stain just a little bit, but not to worry, your tooth underneath is not stained. When you come into the office, we are happy to clean up those attachments, get any staining off there, and restore your teeth to their nice, beautiful color.